Ishwar, and today I'm teaching hypertension. So let's coming to point. Definition of hypertension: the clinical condition in which the blood exerts high amount of pressure against the wall of blood vessels, especially arteries, which is more than normal range, is known as hypertension. So in this, our blood exert high amount of pressure on our walls of blood vessels. Epidemiology: 26% of the world population has hypertension. 1 in 5 young adults in India has high blood pressure, according to research presented at the 17th Annual Conference of the Cardiological Society of India. And moving to next part, that is types of hypertension. There are mainly three types of hypertension: primary hypertension, secondary hypertension, and preeclampsia. Primary hypertension, the most of the people suffering from hypertension are suffering from mostly are primary hypertension. That is, the cause of this hypertension is unknown. Secondary hypertension, that is secondary to disease condition. That is, a blood pressure mainly occurs due to particular disease condition like diabetes, atherosclerosis, etc. Then third type of hypertension is a preeclampsia. That is, this condition is mainly developed in the pregnancy. According to Joint National Committee on Prevention, Detection, Evaluation and Treatment of High Blood Pressure, the blood pressure mainly classify according to JNC rule. Normal blood pressure is 120 by 80 systolic diastolic. Pre-hypertension is 120 to 139 systolic and 80 to 89 diastolic. Stage 1 hypertension is 140 to 159 mmHg and diastolic is 90 to 99 mmHg. Stage 2 hypertension is more than 160 mmHg and diastolic pressure is more than 100 mmHg. So guys, simply, if our systolic blood pressure is 120 and diastolic is 80 mmHg, then person is having normal blood pressure. If their blood pressure increase more than 140, then it is stage 1, and if it increase more than 160 mmHg, then it is stage 2 hypertension. Then what are the risk factors for hypertension? Age. As we know, as age progress, our most of the body parts function is decline. Then second is alcohol. Then third is smoking. Gender, due to hormonal changes, it also play important role. Then obesity because due to fat deposition and like conditions, there is chances of atherosclerosis or vasospasm, which increase the blood pressure. Then stress mainly activate our sympathetic system of our body, so it mainly stimulate to release the adrenaline, noradrenaline, fight and flight hormones, which may increase the heart rate, and this lead to increase in the blood pressure. Then sedentary lifestyle and diabetes also play a major risk for hypertension. Then moving to next part, pathophysiology. The normal blood pressure maintained by four mechanisms: activities of renal system, activities of endocrine system, activities of vascular endothelium, and sympathetic nervous system. So here we study renin-angiotensin aldosterone system. It also called as a RAS system. So here what happened? Angiotensinogen is a hormone mainly released from the liver. After that, renin, a chemical which act on the angiotensinogen, and it convert into angiotensin 1. After that, lungs release ACE, that is angiotensin converting enzyme, which convert angiotensin 1 to angiotensin 2. So this angiotensin 2 first increase the sympathetic activity. Second, it increase tubular sodium chloride reabsorption, which mainly result in water retention. Then third, it act on adrenal gland cortex, which release aldosterone secretion or aldosterone hormone, which increase the water retention in our body. Then fourth one is it cause arteriolar vasoconstriction, which leads to increase the blood pressure. And fifth one is it also release it act on a pituitary gland and release ADH, that is antidiuretic hormone, which act on collecting duct and leads water reabsorption. These all mechanisms have a common effect, that is increase the blood pressure. Activities of endocrine system. When the angiotensin second act on adrenal cortex, it will release aldosterone. This aldosterone act on kidney tubules and reabsorption of sodium chloride occurs. Due to this, water retention occurs, resulting in increased blood pressure. Activities of vascular endothelium. The vascular endothelium is a single cell layer that line the blood vessels. It will produce vasoactive substance and growth factors like endothelin. These substances are potent vasoconstrictor which cause increased blood pressure. Then sympathetic nervous system. When BP is decreasing, the activation of sympathetic nervous system will occur, which increase the sympathetic nervous system activity that result in increase the heart rate and net result that is increase in the blood pressure. Then what are the clinical presentation of high blood pressure? That is first severe headache, second blurred vision, third dizziness, fourth rapid heartbeat, fifth one fatigue, sixth one shortness of breath, seven confusion, eight nausea, nine vomiting. Then how we diagnose the hypertensive patient? So first history collection, that is patient's mother, father or their grandfathers having blood pressure or not. Then physical evaluation, we can observe the beats, is any edema on their legs and hands, is they have received sensation or not, there are any tingling sensation or not. Then medical history, that is patient is having any cardiovascular disease like diabetes, metabolic disorders like diabetes or any heart conditions. Then we can check the ECG, then chest x-ray, size, shape of heart. Then we also check the CBC, that is electrolyte, creatinine and blood volume. These are diagnostic parameters. Then management of hypertension. Mainly the management of hypertension is possible by two ways. First is a lifestyle modification, second is a pharmacological therapy. Lifestyle modification include a dietary approach to stop hypertension, that is DASH diet. Our healthcare develop a diet plan for the management of the hypertension, that is DASH diet. Then second is a weight reduction. So as we observe that, study that if patient is more obese, then it cause vasoconstriction or vasospasm, which result in hypertension. So if we reduce the weight, it leads decrease in the blood pressure. Third one is sodium intake reduction, because as we know, if we eat more sodium chloride, which may alter the water absorption. Then minimize alcohol consumption, exercise, because exercise is very good for any condition, for any disease condition. So if we do exercise, then we are healthy. So that it help in decrease the chances of hypertension or cardiovascular disease. Then stress management, because stress is nowadays many of people are having more workload, having more tensions and all. So stress management is also very important to prevent all such cardiovascular disease. Then moving to next part, pharmacological management. Various drugs are used to treat hypertension. Such drugs are called as antihypertensive drugs. So this is antihypertensive drugs classes. First, diuretics. These are again divided into thiazide diuretic, high ceiling diuretic or loop diuretic, and potassium sparing diuretics. The next, renin-angiotensin system inhibitor, as we studied earlier, RAS system. So these drugs act on that RAS system. First, AC inhibitors. So guys, I will give you here one trick. The most of the drugs name end with the pril are mainly AC inhibitors category. Then most of the drugs name end with sartans are mostly angiotensin receptor blockers category. Then diet renin inhibitor, example is aliskiren. Then sympathetic inhibitors, it include beta adrenergic blockers. These drugs names are mostly ended with lol, that is propanolol, metoprolol, atenolol. Then alpha plus beta adrenergic blockers, example labetalol, carvedilol. So here labetalol is mainly used in pregnancy case. Then next is alpha adrenergic blockers. So these are examples are prazosin, terazosin, doxazosin. So here the name of drug is end with zosin. Then central sympatholytics are clonidipine and methyl-dopa. Then another class of antihypertensive drug is calcium channel blockers. It again divided into phenylalkylamine, benzothiazepine, dihydropyridines. Here dihydropyridines, all drug names are end with dipine, nifedipine, prilodipine, amlodipine, nitridipine. Then next class is vasodilators. Here arteriolar dilator and arterial plus venodilator. So arteriolar dilator include hydralazine, minoxidil, and arterial plus venodilator includes nitropluside sodium. So coming to MOA, that is mechanism of action. Diuretics. It helps the kidney to inhibit the sodium reabsorption in the distal convolular tubule (DCT), ascending limb, and loop of Henle. Then AC inhibitors. This group of medication will reduce the conversion of angiotensin 1 to angiotensin second. That is from 1 to second. It inhibits the conversion from 1 to second and prevent vasoconstriction. Beta blockers. This medication reduces the workload of the heart and blood vessels, causing heart to beat slowly and with less force. The next is alpha blocker. This medication causes the peripheral vasodilation of blood vessels. Next, calcium channel blockers. This medicine will block the movement of extracellular calcium into cells and causing vasodilation and decrease the heart rate. Next class, vasodilators. This medication acting directly on the muscles in the wall of arteries and preventing the muscles from tightening and arteries from narrowing. That is example nitroglycerin. So here is a standard algorithm for the management of hypertension along with the various disease condition. So first one is compelling indication. Here first is a diabetes mellitus. So AC inhibitors or ARB is the first choice. The patient is having both hypertension and diabetes. So in this case, we give AC inhibitors or we prefer AC inhibitors or ARB. If patient having hypertension along with chronic kidney disease, then here also we prefer ACE or ARB. If patient having coronary artery disease, then we prefer beta blocker first. After that, we give ACE inhibitor or ARB. If patient having heart failure with reduced ejection fraction, so here we give ACE inhibitors or beta blockers for the management of volume overload. Then if heart failure with preserved ejection fraction, here we also give same, that is ACE inhibitor or ARB or beta blockers. So this is the standard management for hypertension along with other conditions. But mostly patient having a plain hypertension is mainly given drugs like ACE inhibitors or ARB. So in this emergency case, so when blood pressure falls sudden, so in that case we mainly give injection NORAD 2 mg, that is noradrenaline, and injection dopamine 5 ml in case of cardiac arrest or low BP or beats. If when blood pressure is right during operation, so we observe that most of the time in at the time of surgery, some patients blood pressure increasing suddenly. So in that case, we give injection nitroglycerin 5 ml infused after dilution, or we give Lasix furosemide 20 mg. Thank you.